Hey everyone, Dr. BBT here, and today I'm going to talk about hand rejuvenation using a product called Radiesse. Radiesse is made up of calcium hydroxylapatite. It's a biosynthetic or bioabsorbable product. It's known as a biostimulator, and although it has a filling effect initially, it also stimulates your own collagen to be built and recruited into the area. What we do for Radiesse injection is we use a small needle and we use a cannula to kind of thread it and fanning technique into the back of the hands. This can be used to give extra thickness to the hand if the skin is a little thick. It can also have a restorative effect by recruiting more collagen into the area. This can last up to 30 months. The initial filling effect can last 6 to 8 weeks, but by then your body will already start to recruit collagen into the area. Patients will notice an increase in quality of the skin and a little bit of a thickness of the skin. And that will help kind of efface the areas where you notice the tendon and small veins of the back of the hands. The back of the hands can be a telltale sign of aging. So if you're wondering if you have early signs of aging, you can always look at the back of the hands to see how the thickness of your skin is changing. To see if you're a candidate, call the office and make an appointment to see.